Correlation of lab parameters and chest CT findings in young COVID-19 patients. The pathological findings of COVID-19 are listed here. Some of the findings are similar to changes consistent with viral cytopathy similar to severe acute respiratory syndrome and the Middle East respiratory syndrome. Thromboses of small or middle-sized pulmonary arteries due to local prothrombotic mechanisms associated with dyspnea, hypoxia, and radiological findings are frequently depicted in elderly patients. Radiological findings of COVID-19 have been extensively investigated in the middle-aged and older adults as bilaterally and peripherally distributed ground glass opacities, which were either rounded or patchy in shape commonly associated with subpleural involvement. Age is depicted as an independent risk factor for disease severity and also COVID-19 related deaths with a male predilection. Disease severity in COVID-19 is associated with blood cell alterations, C-reactive protein levels, hemostatic laboratory disorders, and inflammatory markers. The relationship of radiological findings with laboratory tests are depicted in a few studies in elderly patients. However, limited studies have evaluated the radiological and laboratory findings of younger patients with COVID-19. Chest CT manifestations of COVID-19 have been variable in different age groups. The radiological differences of COVID-19 in children compared to adults have been depicted in this table. The differences of radiological incidences in adult, young adults and children have been mentioned here. Lymphopenia, leukopenia, neutropenia, and thrombocytopenia are the most frequent complete blood count alterations in young adults. Elevated C-reactive protein and fibrinogen levels are more frequently encountered compared to blood count alterations. The incidences of elevated troponin and procalcitonin levels were lower than frequency of blood count alterations. Highly significant moderate positive correlations are found between C-reactive protein and all quantitative radiological parameters. Lactate dehydrogenase levels are significantly correlated with the CT involvement score, pulmonary involvement score, and the total number of involved lobes. Fibrinogen levels are correlated with lesion size, size range category, and also the total number of involved lobes. Ferritin levels are correlated with lesion size. D-dimer levels are correlated with the scores of pulmonary involvement and also the total CT involvement. No significant correlations are depicted among the quantitative radiological parameters with leukocyte, neutrophil, lymphocyte, and platelet counts. Age is positively correlated with pulmonary involvement score and lactate dehydrogenase. A mild negative correlation is found between age and lymphocyte count, but not with radiological findings. There are differences in radiological and laboratory parameters among young adults and children with COVID-19. Radiological findings can strongly correlate with biochemical parameters but not blood count results.